Hi, I'm Dr. Melissa Magnuson, and this is Lessons Across Species. I spend about 30 to 40 hours a week in veterinary exam rooms. And over the years, there is one phrase I hear that always makes me pause. Someone will look at their pet and say, well, he's 15. He's probably just too old to do anything. Sometimes that sentence is about surgery, and sometimes it's about anesthesia, or maybe it's about running diagnostics. But the idea underneath it is always the same. The pet is old. So maybe we should just leave things alone. I understand where that's coming from. When our pets age, we want to protect them. We worry that pushing too hard medically might shorten the time we had left together. But the experience that really changed my thinking about this didn't come from a client. It came from my own dog. My dog Toby lived a long life, and for most of his life, I stayed very consistent with his dental care. In veterinary medicine, we call this a COHAT, a comprehensive oral health assessment and treatment. What that mouthful means is that we anesthetize the patient so we can clean and polish the teeth and evaluate each teeth carefully, and then we take dental x-rays. And if we find disease, we can treat it during that same procedure. For years, Toby had routine dentals. But when he turned 17, something shifted in my thinking. 17 sounded old, even to me, a veterinarian. So I made the same decision I hear many pet owners make in exam rooms. I told myself Toby was probably just too old for anesthesia, and I stopped doing his dental procedures. At first, nothing seemed dramatically wrong, but over time, his mouth slowly became a problem. The smell started to change. If you've ever smelled a truly infected mouth, you know it's very different from normal dog breath. It's strong, sour, and it fills the whole room. And that smell is not age. That smell is disease. It usually means severe periodontal infection, inflammation in the gums or bone, or sometimes an abscessed tooth. By the time Toby was 19, his breath was so bad you could barely sit near him. At that point, I had to confront the thing I had been avoiding. Was Toby actually too old? Or was I allowing him to live with a treatable problem because the number attached to his age made me nervous? So I did what I recommended for my patients. We started with a full medical workup. First, a comprehensive physical exam. I evaluated his body, and I listened carefully to his heart. And then we ran blood work. A complete blood count, a chemistry profile, and a thyroid test. And after that, we took chest radiographs to evaluate his heart and lungs. And the surprising part? Toby passed every single test. His organs were functioning well. The problem wasn't his age. The problem was his mouth. So at 19 years old, we anesthetized Toby using short-acting medications and carefully individualized anesthetic plan. And when we evaluated his mouth, we found the issue. And it was an abscessed tooth. I removed the tooth, and we cleaned and polished the rest of his teeth. And we took dental x-rays to evaluate the surrounding bone and the roots. Toby recovered beautifully. Within days, the difference was obvious. He ate better. His breath was normal again, and you could be with him in the same room. And his coat even became softer and cleaner because he was no longer spreading all that bacteria from his mouth all over his fur. He seemed lighter in his step and his body, and I had one lingering thought. I wished I had done it 3 years earlier. That experience changed how I think about aging pets, and I see the same pattern again and again in the hospital. One case that has always stayed with me was a cat named Jellybean. Jellybean was a peach-faced calico who came in at 22 years old. Her owner was worried because she had been losing weight. We performed the full medical workup on her, blood work, organ function test, and surprisingly, this cat looked amazing at 22. But her mouth was in terrible condition. She had really heavy tartar and inflamed gums and a strong odor that told me infection was present. Her owner was understandably nervous about anesthetizing Jellybean at 22 years old. But after evaluating everything with her medically, we determined she was stable enough for a dental procedure. Her owner sat in our lobby almost the entire day waiting for the news. Jellybean came through beautifully. And afterward, something interesting happened. Her owner told me Jellybean started jumping on the kitchen counters again, something she hadn't done in years. She ate better, she moved better, she seemed happier. Jellybean lived another 6 months, and according to her owner, those were the best 6 months she had had in the last 6 years. Not because we dramatically extended her lifespan, but because we removed the source of her chronic pain. This is a pattern I see across species, dogs, cats, and even humans. We often confuse age with disease, but they are not the same thing. Age is simply a description. Disease is a malfunction. 17 years old is a fact. An abscessed tooth is a medical problem. When we treat those things as if they are the same, animals often end up living with problems that are actually treatable. Dental disease is a good example. It's incredibly common and it affects much more than just the mouth. Chronic infection in the gums can affect appetite, grooming, energy levels, and sometimes even the heart and kidneys. Humans understand this instinctively. If a 90-year-old person has an abscessed tooth, you don't say, "Oh, they're too old to fix that." We treat the infection. But animals can't tell us when their teeth hurt. They adapt. They chew differently. They hide the pain, which means we have to go looking for the disease they can't describe to us. Sometimes what we find can be surprising. I once treated a Maltese named Penelope, who came in because she wasn't eating well. She would not allow anyone to examine her mouth while she was awake. So we anesthetized her and we took dental x-rays. Dogs have 42 teeth. Every single one of Penelope's teeth had a fracture beneath the crown that you could only see on x-ray. 42 fractured teeth. None of that was visible from the outside. That case reinforced something important to me. Animals cannot tell us the extent of their disease. We must investigate. So the message I hope pet owners take away from this is simple. Age, it's not a disease. Aging changes how we approach medical care. It means we evaluate patients carefully. We run diagnostics, we tailor treatments and anesthetic plans to the individual animal. But age alone should never be the reason we ignore a treatable problem. Because sometimes what looks like old age is actually pain. And sometimes relieving that pain can give an animal back a level of comfort and vitality their family hasn't seen in years. Across species, the patterns are often the same. If we slow down enough to notice them, our animals are often already telling us what they need. If these conversations about animal health and the human-animal bond resonate with you, consider subscribing so you don't miss the next Lessons Across Species. And if you like the deeper reflection behind this episode, I've written a full essay on my Substack. You'll find the link below.